Now let me discuss the other group of anti-neoplastic drugs. They include anti-tumor antibiotics, right? Anti-tumor antibiotics. Now if you take anti-tumor antibiotics, remember this group includes the anthracycline antibiotics, right? This group include anthracycline antibiotics. Now what are these particular antibiotics? These include doxorubicin, right? These include the doxorubicin. Now what is this particular doxorubicin group of drugs? Doxorubicin, also known as, right, also known as adriamycin, and we have other drug that is called as Daunorubicin and as well as epirubicin, right? Daunorubicin, and as well as the other drug that is epirubicin and as well as 𝗓𝐼𝐷𝐿, right? Epirubicin and as well as the 𝗓𝐼𝐷𝐿. And apart from this particular doxorubicin, we have the other drugs that is called as mitoxantrone, right? Other drugs that is called as the mitoxantrone, and we have bleomycin, dactinomycin and mitomycin, right? Bleomycin, dactinomycin and as well as the mitomycin, right? As well as the mitomycin. So these are your anti-tumor antibiotics. Now remember, you take this particular bleomycin. Except bleomycin, all the drugs are cell cycle non-specific drugs, right? Whereas bleomycin, it acts in G2 phase of the cell cycle, right? G2 phase of the cell cycle. So all other drugs, they are cell cycle non-specific, right? Cell cycle non-specific, right? Except your bleomycin, and this will be asked as a multiple choice question here. Now remember, all anti-tumor antibiotics, where are they obtained from? They are obtained from a microorganism that is called as streptomyces, right? They are obtained from, right? They are obtained from streptomyces. Next, you take this anthracycline antibiotics, right? Anthracycline antibiotics. If you see the mechanism of action of these drugs, anthracycline antibiotics, they act by inhibiting the topoisomerase 2. Right, so if you take the mechanism of action, they act by inhibiting, right? They act by inhibiting the topoisomerase 2. Now you take these drugs, that is doxorubicin and as well as Daunorubicin. They are primarily used in the acute leukemias, right? Doxorubicin and Daunorubicin, they are used in the, right? They are used in the acute leukemias. So doxorubicin and Daunorubicin are used in the acute leukemias, whereas you take the other drugs, that is 𝗓𝐼𝐷𝐿 and as well as epirubicin. Remember, epirubicin and as well as 𝗓𝐼𝐷𝐿, they display a broader activity against the solid tumors, right? They display the broader activity against the solid tumors, and this particular solid tumors, they include breast carcinoma, right? They include breast carcinoma and osteosarcoma, right? Osteosarcoma, Ewing sarcoma, right? Ewing sarcoma, and as well as soft tissue sarcoma, all right? As well as the soft tissue sarcoma. Now if you take these drugs, remember these agents, they also generate semiquinone free radicals. Now this particular semiquinone free radicals, right? These drugs, they also produce the semiquinone free radicals. These semiquinone free radicals, they are the one which are responsible for the cardiotoxicity, right? They are the one which are responsible for the cardiotoxicity, and this particular cardiotoxicity is manifested in the form of dilated cardiomyopathy, and as well as it is manifested in the form of the congestive heart failure. Next, now how can you reduce this adverse effect? Remember, the adverse effect is mainly because of the semiquinone free radicals, and this adverse effect can be reduced by using alpha tocopherol and as well as dextroxoxane, which is a free radical scavenger, right? So what you do is, if you want to reduce this particular cardiotoxicity, you have to use a free radical scavengers. Right, you have to use the free radical scavenger. Now, if you take this particular free radical scavengers, they include the alpha tocopherol, right? They include the alpha tocopherol and as well as dexrazoxane. So, dexrazoxane and as well as alpha tocopherol, they are the free radical scavenger, and by using these particular free radical scavengers, the cardiotoxicity can be minimized. Next. Now we have liposomal forms of these drugs. The liposomal forms of these drugs have decreased the cardiac toxicity, right? Liposomal forms, they will decrease the cardiac toxicity, right? They will decrease the cardiac toxicity. Next, you take this particular dilated cardiomyopathy. Dilated cardiomyopathy, it is accumulative, dose dependent, and may present even after the discontinuation of this anthracycline. Okay, so this dilated cardiomyopathy, it is dose dependent, it is having the cumulative adverse effect, right? It is having the cumulative adverse effect and it occurs even after the discontinuation. So remember, even after the discontinuation of these anthracyclines, there can be the development of dilated cardiomyopathy. Next, now within this particular dilated cardiomyopathy, remember how does this dilated cardiomyopathy develops? What is the earliest morphological change? Let me discuss about that. So before that, let me shortly revise up to here. Like we have what is called as the anti-neoplastic drugs, that is anti-tumor antibiotics. All of these drugs, they are derived from the streptomyces. Now in this anti-tumor antibiotics, like we have the anthracycline antibiotics, that is the doxorubicin, also known as adriamycin, daunorubicin, epirubicin and 𝗓𝐼𝑑𝑎rubicin, and the other drugs include metoxantrone, bleomycin, dactinomycin and as well as mitomycin C. Except bleomycin, which is acting in G2 phase, all other drugs are cell cycle non-specific drugs. And remember, all these anti-tumor antibiotics, they are obtained from the streptomyces. And this anthracycline antibiotics, remember, they act by inhibiting this particular topoisomerase 2. Next, the other point is, you take this particular doxorubicin and as well as the daunorubicin. They are primarily used in acute leukemias, whereas 𝗓𝐼𝑑𝑎rubicin and as well as epirubicin display broader activity against the solid tumors, that is breast carcinoma, osteosarcoma, Ewing sarcoma and soft tissue sarcoma. And these agents, remember, they produce a free radical which is called as the semiquinone, and that is responsible for your cardiotoxicity. Remember, this cardiotoxicity is manifested in the form of dilated cardiomyopathy and congestive heart failure, and these adverse effects can be reduced by using alpha tocopherol and as well as dexrazoxane. These two substances, that is alpha tocopherol and as well as dexrazoxane, they are free radical scavengers. Next, you have the liposomal forms. Remember, liposomal forms of these drugs, they have decreased cardiac toxicity. Next, you take this dilated cardiomyopathy. Remember, DCMP, it is cumulative, dose dependent and may present even after the discontinuation of this particular anthracyclines. Now let me tell you what will be the earliest morphological change in the development of either DCMP or congestive heart failure. So these drugs, they are known to cause the dilated cardiomyopathy and as well as the congestive heart failure. Now let me tell you what will be the earliest morphological change for the development of this congestive heart failure or the dilated cardiomyopathy. Remember, these drugs, they will cause the morphological feature, that is the earliest morphological feature is the swelling of the endoplasmic reticulum. Right, swelling of the endoplasmic reticulum. Now, after the swelling of the endoplasmic reticulum, remember, it is followed by the loss of the cardiomyocytes, right, followed by the loss of cardiomyocytes. Now, if you take these cardiomyocytes, they are nothing but your myofibrillar dropouts, right, myofibrillar dropouts, that is your cardiomyocytes. Now, what will be the symptoms? Remember, in either DCMP or congestive heart failure, the symptoms or the clinical features, they include the exertional dyspnea, right? They include exertional dyspnea, orthopnea, right? Orthopnea, and as well as the peripheral edema. Now, if you take these drugs, remember these drugs also can cause the red colored urine, right? These drugs can also cause the red colored urine, but not hematuria, right? But not hematuria. Now, another important feature of these drugs is that these can cause what is called as radiation recall reaction. These drugs can also cause radiation recall reactions. All right. Now, what is this radiation recall reaction? That includes, right, that includes erythema, that includes desquamation of the skin, right, that includes the desquamation of the skin, which is seen in sites of prior radiation therapy, right? So that is about your radiation recall reaction. Now, we have a drug in this particular group that is called as mitoxantrone. Now, if you take this mitoxantrone, remember mitoxantrone, it seems to be less cardiotoxic than the other drugs of this particular group. So we have seen that these drugs, they produce a free radical, and that is what is responsible for the development of dilated cardiomyopathy, right? And how can you reduce this particular cardiotoxicity? By using a substance which is called as alpha tocopherol, which is a free radical scavenger. Now, this mitoxantrone, it is having less of development of the cardiotoxicity. This mitoxantrone, remember, it has been approved for the treatment of the acute myeloid leukemia, right? It is approved for the treatment of the acute myeloid leukemia. And not only in the treatment of acute myeloid leukemia, it is also used for advanced hormone resistant the prostate cancer, right? Advanced hormone resistant prostate cancer, and it is also used in the treatment of late stage secondary progressive multiple sclerosis, right? That is SPMS, right? Also used for the treatment of late stage secondary progressive multiple sclerosis. And an advantage of this mitoxantrone is it is less cardiotoxic, but the problem with this is it can result in acute promyelocytic leukemia, right? So the adverse effect of this, the mitoxantrone, is it can cause acute, right? It can cause acute promyelocytic leukemia. Now, we have another drug that is called as Daunorubicin, right? That is Daunorubicin. So if you take this Daunorubicin, it is approved for the intravesical therapy in case of urinary bladder carcinoma. So in case of the urinary bladder carcinoma, this Daunorubicin, it is injected directly into the bladder, that is intravesical, right? It is used as the intravesical therapy. Next, now let me tell you another drug which is called as dactinomycin. Right, other drug that is called as dactinomycin. Dactinomycin, it is your actinomycin D, right? It is your actinomycin D. Remember, dactinomycin, it acts by inhibiting the DNA dependent RNA synthesis, right? It acts by inhibiting DNA dependent RNA synthesis. That is about your dactinomycin. And remember this point, this dactinomycin, it is indicated for solid tumors in the children, right? It is indicated for the solid tumors in the children. And what are those particular solid tumors? That is, they include Wilms tumor, and not only that, it also includes rhabdomyosarcoma, right? It also includes rhabdomyosarcoma. And not only that, this particular dactinomycin, it is also used in the treatment of choriocarcinoma, right? Also used in the treatment of the choriocarcinoma. And remember this point, this particular dactinomycin, it is a radiosensitizer, right? Remember this point, it is a radiosensitizer. Now, in these drugs, like you take bleomycin, what we have discussed, all the other drugs are cell cycle non-specific, whereas bleomycin, right? Whereas bleomycin, it is cell cycle specific glycopeptide drug, right? Cell cycle specific glycopeptide drug. And this particular bleomycin, it acts in the G2 phase by causing DNA strand breakage and free radical formation, right? So where does it act? It acts in the G2 phase of the cell cycle. And what does it do? It causes the DNA strand breakage, right? It causes the DNA strand breakage and as well as free radical formation, right? As well as the free radical formation. Now, if you take the adverse effect of this particular bleomycin, remember bleomycin can result in the cutaneous toxicity, right? So the disadvantages of this particular bleomycin is this can cause cutaneous toxicity. Now, if you take this cutaneous toxicity is manifested in the form of hyperpigmentation, hyperkeratosis, erythema and as well as ulcers. Apart from this cutaneous toxicity, this bleomycin can cause pneumonitis, right? Can cause pneumonitis. It can also cause, right? It can also cause the pulmonary fibrosis, and apart from this, it also include the hypersensitivity reactions and mucocutaneous reactions, right? Hypersensitivity reactions and as well as mucocutaneous reactions. Now the earliest indicator of an adverse effect is decrease in the diffusion capacity of the lung for carbon monoxide. So what we have discussed is this bleomycin can cause pneumonitis and pulmonary fibrosis. Now how can you make out, right? How can you make out that bleomycin is causing this pulmonary fibrosis? The earliest indicator of adverse effect is the decrease in the DLCO. Right, the earliest indicator is decrease in the DLCO, that is diffusion capacity of the lung for carbon monoxide. Now, this particular bleomycin, remember, it causes the necrosis of type 1 pneumocytes and that results in compensatory hyperplasia of type 2 pneumocytes, right? So what does this particular bleomycin do? Remember, this particular bleomycin, it causes the necrosis of type 1 pneumocytes, right? They will cause the necrosis of type 1 pneumocytes and thereby results in compensatory hyperplasia of type 2 pneumocytes. Now, if you take the metabolism of this bleomycin, remember bleomycin is metabolized by an enzyme which is called as bleomycin hydrolase, right? It is metabolized by the enzyme called bleomycin hydrolase, and this bleomycin hydrolase concentration is less in skin and lungs. Thus, major organs involved in toxicity is your skin and as well as the lungs. Okay, so bleomycin is metabolized by bleomycin hydrolase, whose concentration is less in skin and lungs, and thus major organs involved in the toxicity. Now, you remember, like, we have an entity which is called as bleomycin toxicity. Bleomycin toxicity may become apparent after exposure to transient very high inspired oxygen, because bleomycin dependent electron transport is dependent on the oxygen. Alright, so remember, in bleomycin toxicity there may be defect in the electron transport chain. Let me shortly revise up to here what we have discussed. So we have seen that the dilated cardiomyopathy and as well as the congestive heart failure, the earliest manifestation is the swelling of the endoplasmic reticulum, and followed by swelling of endoplasmic reticulum there is loss of the cardiac myocytes, which is nothing but myofibrillar dropouts. And the clinical features associated with this congestive heart failure include exertional breathlessness, orthopnea and as well as the pulmonary edema. These particular drugs, they can also cause the red colored urine, and remember, it is not hematuria. Right, remember, it is not hematuria. Now, these drugs can also cause what is called as radiation recall reactions, which includes the manifestations as erythema and as well as the desquamation of the skin. Now, we have a very important drug which is called as mitoxantrone. Mitoxantrone seems to be less cardiotoxic than other drugs of this group, and this mitoxantrone, remember, it has been approved for acute myeloid leukemia, advanced hormone resistant prostate cancer, and in the treatment of late stage secondary progressive multiple sclerosis. And remember, this mitoxantrone, it is less toxic, less cardiotoxic, but can result in acute promyelocytic leukemia. Then we have another drug which is called as Daunorubicin. Valrubicin is approved for intravesical therapy in case of the urinary bladder carcinoma, and you have the other drug called dactinomycin, which is nothing but your actinomycin D. It acts by inhibiting DNA dependent RNA synthesis, and it is indicated for solid tumors in the children, that is rhabdomyosarcoma and as well as Wilms tumor, and it is also indicated in the treatment of the choriocarcinoma. And remember, your dactinomycin, it is a radiosensitizer. Now coming to your bleomycin, bleomycin is a cell cycle specific glycopeptide drug that acts in the G2 phase by causing DNA strand breakage and as well as the free radical formation. And remember, this particular drug can cause the cutaneous toxicity, and if you take the manifestation of cutaneous toxicity, they include hyperpigmentation, hyperkeratosis, erythema and as well as ulcers, and the other adverse effects include the pneumonitis, pulmonary fibrosis, hypersensitivity and mucocutaneous reactions. And earliest indicator of the adverse effect is decrease in the DLCO, and that is nothing but diffusion capacity of the lung for carbon monoxide. And remember, this bleomycin can cause necrosis of type 1 pneumocytes, and that results in compensatory hyperplasia of type 2 pneumocytes. And if you take the bleomycin, remember bleomycin is metabolized by bleomycin hydrolase, whose concentration is less. That means the bleomycin hydrolase concentration is less in the skin and as well as lungs, and thus the major organs involved in the toxicity is within the lungs and as well as the skin, because the concentration of the bleomycin hydrolase is less in the skin and as well as the lungs. So that is why the bleomycin which has been accumulated in the skin and lungs, it is not metabolized, and thereby you have the skin necrosis or cutaneous toxicity and as well as the pulmonary manifestations. Now bleomycin toxicity may become apparent after exposure to transient very high inspired oxygen, because bleomycin dependent electron transport is dependent on the oxygen. Now let me discuss another drug that is called as mitomycin. Now let me discuss another important drug which is called as the mitomycin. So if you take this particular mitomycin, it acts as the alkylating agent. Now a point you need to remember here is this mitomycin may be used as intravesical therapy to treat superficial bladder cancers and as well as the anal carcinoma, right? So, right, it is used as the intravesical therapy to treat superficial bladder cancers, right, to treat superficial bladder carcinoma and as well as, right, and as well as the anal carcinoma, right? So with radiation therapy. So along with radiation therapy, if you give this particular mitomycin, it is used in the treatment of anal carcinoma. And if you take the adverse effect of this particular mitomycin, it can cause the hemolytic uremic syndrome, right? It can cause hemolytic uremic syndrome. Now remember, it is best available drug for use as an adjuvant to X-ray radiation to attack the hypoxic tumor cells. Okay, so it is the best available agent for what? It is best available drug for use as an adjuvant to X-ray radiation to attack the hypoxic tumor cells, right? Hypoxic tumor cells. Now why? Because it is converted to active alkylating agent by reduction. Next, remember, apart from this particular hemolytic uremic syndrome, the other adverse effect is this particular drug can cause delayed bronchospasm, right? This particular drug can cause delayed bronchospasm. Now the other important point is this mitomycin, remember, it is also used in patients with tracheal or laryngeal stenosis, right? Apart from the usage in case of hypoxic tumor cell, it is also used in patients with the tracheal and laryngeal stenosis, right? Tracheal and laryngeal stenosis. So this is about your mitomycin. Remember, mitomycin, it is an alkylating agent. It is used as an intravesical therapy in the treatment of superficial bladder cancers and as well as anal carcinoma. And the adverse effect associated with the mitomycin is the hemolytic uremic syndrome and as well as delayed bronchospasm. And this particular mitomycin used in case of the hypoxic tumor cell, and is also used in case of the tracheal and as well as laryngeal stenosis. Now, let me tell you overall the distinctive toxicities of natural anti-cancer drugs, right? The distinctive toxicities. Now, if you take the drug that is bleomycin, right? Bleomycin is the drug which can cause pulmonary fibrosis, right? Bleomycin is the drug which can cause pulmonary fibrosis and it will spare the bone marrow. And you take the drugs that is anthracycline. Anthracyclines are the group of drugs which will cause the cardiotoxicity, and this particular cardiotoxicity is in the form of dilated cardiomyopathy and as well as congestive heart failure. And you take the drug that is paclitaxel. If you take this paclitaxel, this can cause peripheral neuropathy and as well as the hypersensitivity reactions, right? Peripheral neuropathy and hypersensitivity reactions. Then you take the drug that is docetaxel. If you take this docetaxel, remember it will cause peripheral neuropathy and as well as the fluid retention, right? Peripheral neuropathy and fluid retention. Then you take the drug that is irinotecan. Irinotecan is the drug which can cause the adverse effects that is diarrhea, right? That is the adverse effect that is diarrhea. Next, you take the drug that is vincristine. Vincristine is the drug, the toxicity associated with the vincristine is peripheral neuropathy, and this is marrow sparing, right? This is marrow sparing, and as well as it will cause what is called as SIADH, that is syndrome of inappropriate antidiuretic hormone. So these are the distinctive toxicities associated with these drugs.